Good morning.
Good morning, everyone. So I guess what we want to do today is kind of introduce this kind of new way of looking at it, right? And our title is called Flipping the Script on Healthcare. Flipping the script, you guys know what that stands for? It's basically changing it around, right? So you have an accepted dogma or accepted model, and your idea is almost like, would you do it in yoga? What do you say? You flip when you do downward dog, and then you flip over. What do you call that move? When you flip your dog. Flip your dog.
Oh, yeah.
Right? You're the
Okay.
yoga teacher, aren't you?
Yeah, right.
Yeah. So let me start off by saying.
I'm in trouble already.
Yeah. So this is me. I'm Robert Graham, as Katie mentioned. So ever since I've ever known, I've always wanted to be a doctor. Just a little bit of background. My mom is from El Salvador, and she is a traditional folk healer. My father was born in Washington State and on a farm, and is a trained biochemist. So
and Rob also grew up in Jackson Heights, New York, which is the most culturally diverse neighborhood in the world. So he mentioned to me at one time that none of his friends spoke English at home. And I know everybody here speaks French, but he had friends from all different countries, and I guess from Buffalo, New York, where I didn't really grow up with people from different countries. So I that's very unique.
And
Jackson Heights.
one of the fascinating parts, right, is that traditional cultures, I believe, right, they have their own way of believing, their own belief of health and wellness, right? They're always doing their own thing, right? And it's interesting, growing up in a community like that, the Western model, or the allopathic model, is the alternative, right?
For them.
For them, you know. So for me, it was like a complete, I always wanted to be a doc, but I always wanted to marry both. I wanted to always marry the traditional complementary and alternative, but also grounded in scientific study of Western medicine.
And his mom is still never has listened to anything
Yeah,
he
my
has
mom's
said
a
as a
doc
doctor.
still.
She's the doctor of the family if you ask her. She makes her own witch's brews and still, so that's been very impactful on you.
Yeah. And so I figured I'd dress up. I'm wearing my Canadian tuxedo for all of you today. And this is Julie.
And here I am, and I already explained that I'm from Buffalo, New York, and I met Rob the old-fashioned way in a bar at 4 a.m, 21 years ago. So there's still hope for you barflies out there to find your soulmate. Yeah, I was the last girl in the bar, so
No,
I
you
was
were the prettiest girl at the bar.
and I was also the last girl in the bar. I was Rob's last chance.
21 years later, I guess it still works.
Yeah.
And together we are called FRESH Med. Again, way of background. So remember, that's kind of my history. And I was fortunate enough to be at the beginning of this movement called integrative medicine. Does anyone ever hear that term? Yeah. All right. So integrative medicine, for those who don't know, it's really a scientific, evidence-based approach to medicine that combines both conventional Western medicine, allopathic medicine, and all other things, including food, prayer, connections, love, homeopathy, chiropractor, massage. You get what I'm saying, right? So it's an evidence-based approach where there is, what I like to call it, and one of my mentors, Andy Weil, right, says, you cherry pick the best what's out there, right? So instead of giving the traditional X prescription plan, you actually may have a XYZ prescription plan. And so that's a little bit of the background.
Yep, and FRESH Med was a concept, Rob being a hip-hop kid from Queens, New York. 4 years ago, we were out to dinner on Valentine's Day, and he's like, I love the word fresh. Fresh meant like your girl is fresh, you have fresh sneakers. And I said, let's make it stand for something. And at that conversation at dinner, we defined fresh, which we're going to share what it means, what it stands for.
So I have a background in anthropology. God bless. I have a background in anthropology, and Margaret Mead is one of those people that this quote really kind of resonated with me, and I think it's a good life motto that don't think someone else is going to do it. Right?
Be the change.
Be the change. And if you see in the New York subway systems, right, there's a thing called see something. If you see something, say something. And I think that's really a good kind of way of looking at life. And so for me, remember my background, I just realized that. Yeah, there's an important role of Western medicine. But that model doesn't work for what's hurting us today, right? Chronic diseases. things that there isn't a magic pill for, right? If you break your leg, you got to go to the doctor, right? If you have an infection, you need antibiotics. And I think there's this beautiful kind of dance that can really happen if you combine it very mindfully. So I got to say something, right? So our healthcare system is messed up. And I'm going to introduce to you a little bit of the bad stuff first, right? So the next 4 minutes is going to be a buzzkill. I'm just telling you guys.
And we're talking about the U.S., so Canada.
Think about how you can actually think of developing your own kind of healthcare. And really, this was an exercise for us, right? So as Katie mentioned, I was a director of integrative health and wellness for an entire healthcare system.
Of how many employees?
61,000 employees, 22 hospitals. So I was their doctor. And I'll tell you a little bit of my story throughout the slides. But just to let you know that about 1.5 years ago, I was asked to see patients faster. And which led me to leave and start my own thing. So this is kind of what happened, right? The patient said, what seems to be the problem, Mrs. Johnson, the doctor asked. I feel the way you look. And although this is a funny cartoon, what's happening in America, and I think abroad as well, you're starting to see these things happening, is that 1 in every 2 physicians experience burnout. It's not just fatigue, it's actually a state of mental illness. Right?
And didn't you, okay, I'll wait till the next slide. Go ahead.
This is Julie, by the way. And this is not just happening in physicians. You're starting to see this rates of burnouts in nurses and all other healthcare professionals. And Julie always says, you can't
pour from an empty cup. So we need our physicians and our nurses to not be so depleted emotionally, physically, mentally, because how can they really help us if they're depleted themselves?
And I don't know if you know this startling fact for me. 400 doctors die each year from suicide, right? And you, as the lay people, don't hear about it, right? It's the #1 profession of suicide, right? Which is just mind-blowing. And it's not, and again, it's not, you know, we go into medicine very altruistic, wanting to help others. And it's not the medicine we do, it's how we do it, right? And how we're forced to do it. And unfortunately, we have put profits over people.
Yeah.
Right. And that's
factory. Really, it's a lot of docs are saying that they feel like factory workers.
And this is it, right? So 8 minutes per person per visit on a follow-up visit. The doctor interrupts you in about 18 seconds. So just think about that. When you're getting your story across, in about 18 seconds, the doctor will interrupt you because there is a stop clock behind them.
And can I just also add, there's a lot of people that I hear in my world as a yoga teacher and a health coach, like, oh, you know, these doctors, they're rushing me and they're making me wait. And there's a perception that doctors are doing their own thing, or maybe you watch too many episodes of General Hospital growing up, that like the doctors were flirting with the nurses and there was all this like sexy stuff going on. And nobody's realizing that their doctors are being pressured by administrators to hurry up and double booking. And I've heard Rob say, how come I have 3 patients booked at the same time? You know, so we have to give our docs a break.
So besides the 8-minute thing, is this whole, and David Wolf said it yesterday, right? There's a perception of pill for an ill, right? It really works, and it works really well in a reductionist model, right? You find the bug, you give the drug. That's the way it works, right? But really, what we're trying to do is really identify the cause, right? And the cause doesn't happen the cause is just it's layered, right? And this is interesting, right? In America, the more a drug is marketed to physicians, the more likely it's prescribed, right? And on top of that, what's really interesting, 2013 CDC data shows that here, homicide with firearm, right? This is deaths per 100,000. So 3.6 deaths happen per year due to firearms. Just want to point out here to the top 2 here, prescription drugs and drug overdose, right? So drug overdose, about 14 deaths per 100,000. And prescription drugs is about 7.5, right? So they're actually saying this, now guns are safer than prescription drugs. And in fact, it's the #1 third cause of death besides heart disease and cancer, which are the top 2 in the US, medical errors. And so clearly, you guys are getting frustrated what they perceive as a limited set of options provided by allopathic medicine, which basically amounts to, like I said before, either drugs or surgery, and want more choices for wellness and healing than allopathic medicine can provide. And in fact, this is a funny cartoon. The truth is, doctor, I've lost faith in Western medicine. And that's one of my favorite quotes, again, from Einstein, right? Just to think about doing the same thing and expecting a different result. That's the definition of insanity. And that's what you're seeing, right? You're seeing that people are just going crazy and taking their own lives because they cannot work in this model. And so that's why we are flipping the script in healthcare. And this is one of the first flips, right? So the sign of a good doctor should be how many patients he can get off medications, not how many people he puts on medication. This is not a new theory. This is really from the traditional Chinese medicine point of view and Ayurvedic point of view, right? And in fact, in Chinese medicine, the good doctor doesn't get paid his full money until patient gets cured.
And can I just mention that Rob, through his integrative practice, has gotten people off of their medications, you know, diabetics and things like that. Even our doorman recently is like, I am a diabetic, doc. What should I do? And Rob said, did your doctor tell you it's reversible? And he said, no, my doctor told me I'm going to be on meds for the rest of my life. And now he's off of his meds and he's really excited every time he sees us. But my point being is, when Rob got his patients off of medications, admin was calling him saying, Dr. Graham, your numbers are down. Where are these patients? So they want to keep you sick enough that you come back, which is really twisted.
And so this is a funny cartoon. The patient says, doctor, I don't feel well and I'm not sure why. Doctor says, I want you to meditate for 20 minutes, twice a day, exercise for at least 30 minutes a day, avoid processed foods, eat plenty of organic fruits and vegetables, spend more time in nature and less indoors, stop worrying about things you can't control, and ditch your TV, and then come back and see me in 3 weeks.
And all of, yeah.
Right?
And all of those have the FRESH model underneath them, every single one.
Yeah.
Yeah.
So
imagine if we could create something that was preventative, and we have to give our doctors a break too. They were taught pathology in medical school, not wellness and not prevention. So they're doing what they were trained to do, and so luckily we have someone like Dr. Graham.
Oh, thank you, Julia. Look at I have you. So I want you to just remember this is the WHO, right? The World Health Organization defines health as a state of complete physical, mental, and social well-being. And social well-being. Julie's talk on Friday was on positive psychology. Other people matter. And that's why we're all here today, right? Because we want to be part of something. And I think this community that Wanderlust promotes.
We love them.
You know, and it's amazing. And this is really important, not merely the absence of disease or infirmity. Right? That's really the important factor that we want to kind of hit.
Well, it was almost like just because you're not sick doesn't mean you're well.
Right.
It's like the same thing that we talk about in positive psychology.
And, you know, colleagues at Harvard, that's the other thing, too. So I was fortunate in 2002, right, to be at the beginning of this movement called integrative medicine. In 2002, there were 4 spots in the entire U.S. in integrative medicine. 2 spots at Andrew Wiles in Arizona, and then Harvard started a new program in integrative medicine. And then if you go to Harvard, right, you really are there to be kind of a thought leader, right, when you get in there. And either you become an educator or a researcher. And so I first went through the research route to really understand how to integrate all of this other stuff into our conventional medical model. In that training, I obtained a master's in public health from the Harvard School of Public Health as well, which really kind of just blew my mind. Helping one person at a time is awesome, but helping communities is really, I think, the real public health and where change really happens. And so Harvard University research says 80% of heart disease, stroke, and diabetes, and 70% of cancers can be prevented by not smoking and by exercising, managing stress, and eating a healthy diet. And then I learned about Wendell Berry. Do you guys know Wendell Berry? Wendell Berry, look him up. He just won the Humanitarian Award by Obama 2 years ago. People are fed, just listen to this one, ready? People are fed by a food industry which pays no attention to health and are treated by the health industry which pays no attention to food, right? So that made us have an idea. Which our first, that was the bad news, okay, guys? Now it's going to be
Flipping the script.
Now we're flipping the script. All right, so this is the first thing. So we started taking doctors cooking. We'll show you slides in a little bit. But then we partnered with this movement called the Monday campaigns.
Meatless Monday. Does anybody know about the Meatless Monday?
So that's one of their campaigns.
Yep, and they have several. Look under Monday campaigns. They have De-Stress Monday. Their Instagram account for De-Stress Monday has amazing graphics that even kids could understand. Also, Meatless Monday, Move It Monday, Caregivers Monday, Man Up Monday, because according to Johns Hopkins, Monday is the day all health breaks loose, meaning people that start up good behavior on a Monday or end a bad one are more successful. And also words like health and people the word health is Googled more on a Monday, and people call for doctor's appointments on Mondays. So Monday is the day. So instead of looking at it like, oh, it's Monday, it's a great way to start off your week in a positive direction.
So in my role as the Director of Integrative Health and Wellness for the entire healthcare system, we were able to put in Meatless Mondays into 7 of our hospitals. Again, it's not taking out, it's adding in an option. And then I said, well, what if we do this? Research shows that if you actually give someone a prescription, they're more likely to fill it. So these are real prescriptions from what they used to call prescription pads, right? Of eat real food, eat a whole food plant-based diet, and eat fruits and vegetables 365 a day. And guess what? We used to give them to patients, and patients used to fill them, right? And now there's movements like Wholesome Wave. If you don't know about them, it's FVRX. They're actually now, you can actually take the doctor prescription to farmers markets and actually cash them in. And in fact, you get 2 for 1. So for every $1 of anything that you spend from a produce point of view, if you choose a fruit and vegetable, you get $2 per $1. So change is coming, change is coming. And then this is the other thing we started to do. Before we became Fresh, we were Fair Wellness, and we started taking doctors, literally, physicians, out of the hospital and into the kitchen.
At a cooking school.
At a culinary school. And one of the principles of that was that there was a study done by Erica Frank in 2004. It said that the doctor's own health behavior was the greatest predictor of them counseling their patients on a health behavior. Doctors that do yoga prescribe yoga. Doctors that wear helmets while they bike are more likely to talk to their patients. Doctors that don't smoke counsel their patients about not smoking. So we said, well, what if we take doctors cooking? Would they be able to talk to the patients more about healthy eating and cooking?
And we did it on a Monday, and it was all vegetarian foods.
And this is doctors, right? And we pair it with wine because wine is plant-based, right?
It's a fruit.
It's a fruit, right? Exactly. And then what happened is that the chefs of the hospital were like, well, why are you taking doctors cooking? What if you take us cooking? So these are a bunch of chefs from each of the hospitals that I took into the culinary school to teach them how to cook plant-based foods. And they did on Mondays.
Yep.
And then Julie.
This was my first meditation class with resident doctors. If you came to my talk, and I'm positively psyched the other day, I mentioned this, but I saw Rob through his residency and was like, this is so twisted. I remember Rob waking me up at 4 a.m. and being like, bye, I won't be home tomorrow, but I'll be home the next day. And I was like, this is so weird. I mean, how can you work 36 hours straight? So I realized that there was definitely a need for meditation. And so I created the Lenox Chill Initiative at Lenox Hill Hospital, which is still going on. And these are all medical residents doing meditation.
Again, using that premise, if you teach them, if you teach them how to fish.
I want you to remember the relaxation response. How many of you have ever heard of that? How many of you have never heard of the relaxation response? Oh, okay. Look this up. It's the opposite of the stress response that was...
How many people have heard of the stress response?
How many people know the stress response, that feeling of, fight or flight? There's an opposite response that a cardiologist, Herbert Benson, discovered by witnessing Tibetan monks in meditation, and they were in the Himalayan mountains. It's sitting on ice, and they weren't even shivering. And it was the first bridge of mind-body medicine. And so know about the relaxation response. It's basically like find your breath, and when the mind gets distracted, go back to the breath, and within 10 minutes or so, your body will go into the opposite of the stress response and into the relaxation response. So that's a tool that's with you at all times. If you remember anything, go and look more into the relaxation response.
It's activating the parasympathetic nervous system, which is the opposite of the sympathetic nervous system, which is activated during the stress response. right? So, and so then right, Julie started teaching doctors how to do meditation, and then we said, oh, in New York, everything is so tight and there's no room. So they said, well, there's no room for meditation. There's no space. So I said, well, there's rooftops. So this is rooftop yoga at a hospital.
So I started that class, rooftop yoga.
This is me over here, right there. Yeah. And then I said, well, what if I start prescribing meditation and yoga to my patients, right? So I took out my pad again and started writing prescriptions for them. And then what happened? Victory Gardens. You know Victory Gardens? You ever hear of Victory Gardens? Victory Gardens was a World War II initiative by the government, President Truman, basically ciphering off commercial production of fruits and vegetables.
Ooh.
Fruits and vegetables to go to the war. So what happened was so commercial fruits and vegetables were all shipping over to the World War II effort. And when the government started giving people, citizens, the ability to grow their own gardens in communities, in front yards, and actually gave seeds to the U.S. So they actually planted their own victory gardens. And the whole idea was that our food is fighting overseas. And so then every day I was walking by this garden, right? And 8 years ago at Lenox Hill Hospital in New York City, right in smack where
Sarah Jessica Parker. Where Beyonce had blue ivy.
Where Beyonce had blue ivy, right, exactly.
And Sarah Jessica Parker had her kids, and then people know what it is, or where it is.
Generation, I'm going for generations.
Okay.
So then this is abandoned rooftop, right? And we used to go there about 8 years ago when I was a resident, 10 years ago when I was a resident, and we used to sunbathe, and people used to smoke up there. And then what happened in New York City, the smoking ban came in, and they said, you can't go outside. And so when I returned from Harvard, and I said, what happened to the garden? They said, oh, it's closed because you can't smoke up there.
So they locked the door and...
That's it.
And I remember drinking some wine with Rob one night, and I was like, what do you mean that? Knock on some doors and get that rooftop open. And luckily, Rob had a grant to do something in wellness, and sure enough...
We turned this into this. And these are just some pictures. There's rocking chairs, right? As remember, combating fatigue and burnout and depression. My favorite thing is to see, a healthcare worker just rocking back on that chair. Everything we grew up there, fruits and vegetables and herbs, were all organic. We were respectful of biodiversity, sustainability. The wood was organic as well. The biggest problem we had so many people up there. Opening day, they expected 100 people. Over 300 people showed up to hang out there. And it's still, it was on today's show, we were all over the place talking about this radical idea, and we called it Victory Greens. Again, an homage to the Victory Gardens. Because I don't know about your hospital food. How's the hospital food here in Canada? Sucks, right? So we had this idea that if food was the problem, it has to be the solution. And if you can't trust who's giving it to you, just grow your own shit, I always said, right? So we started growing our own stuff. And what's fascinating is that then the people, our staff, was like, where can we get the herbs? Can we take some home? And every Thursday, we ended up doing snip parties. So we'd give patients and employees samples so they can go home and cook. And they used to hashtag Victory Greens. And then what happening is that some of our favorite restaurants in the neighborhood, like the Candle Cafe, I don't know if you guys know, it's a vegan restaurant in New York City, started hearing about this. They were like, well, would you want to do something together? So we ended up donating the end of the year harvest to food pantries and to restaurants in their neighborhood. So really, again, changing the community around us.
And this is probably something we're most proud of. We were able to name it Victory Greens. We were able to pick out all of the furniture, and we hired the urban farmer and got the ball rolling, and it's our baby.
And now our new baby, in the next, 5 minutes, we'll just kind of go through this all, is FRESH Medicine. And we felt that self-care is the best form of healthcare, right? And health doesn't happen in the doctor's office or in the hospital. It happens where you pray, it happens where you live, it happens at Wanderlust, it happens in yoga studios. And so we kind of came up with this acronym.
For FRESH.
For FRESH, right? Food, relaxation, exercise, sleep, and happiness.
And that puts your health back into the control of you. You're in control of your health. And I think people are forgetting that. You're going to your doctor and you're saying, fix me. And I think there's actually I think it's refreshing to know that we are in control of our health. These are all things we can do on our own.
And this is our model. So in every patient encounter, we'll show you how we do it. Every patient encounter, right, we ask you the traditional medical intake, but we also ask you these things. And we'll show you a picture in a little bit, but the core team is me, the physician, Julie, the health coach, meditation, mind-body person, and a clinical nutritionist. And do you want to talk about this at all?
No, I think we can keep going.
And so this is what it looks like. So you can come a la carte, we would call it, right? We can come in just to see the doc if you have something urgent, if you want to see just a nutritionist. And we realize that the health coach, what Julie does, right, spinning it on positive psychology, is really the mindset, right? Because we kind of know what not to do, then why do we do it, right? And so that really is the shift, the mind shift, right? Wanting to be better, deserving to be better, wanting yourself to be better. And so this is a typical intake here.
But you also have privacy. We're not all in there at the same time.
Yeah.
All the time.
No, we are there sometimes, you know, on a visit that
but
really.
But you get privacy with you. What I'm saying
yeah.
is there, you get individual.
And so what I think is really beautiful about this, right, that's the core FRESH team, but we've actually partnered with one of our very best friends. His name is Rudy, and they run Physiologic. And we've been friends for 20 years. Actually, Julie, my brother-in-law, and Rudy went to school together, elementary school together.
I grew up with Rudy in Buffalo, New York, the owner here in the white, light blue shirt.
And what he started is a chiropractor massage Pilates studio. And for the past 10 years, he was like, dude, we got to do this together. We got to do this together. And so now we actually have teamed up for the last year and a half and started a real beautiful health space. It has everything from, we do acupuncture,
chiropractor, massage therapy, physical therapy, pain management, nutrition,
massage,
positive psychology, health coaching, massage,
aromatherapy. The only things we don't have from a real is reflexology. There's two things I want to get there: reflexology and Ayurvedic. That's what we don't have just yet.
And that's our space, just so you know.
Yeah, this is our studio. And so everything is mobile. And so you can host about 50, 60, 100 people in there. That's where Julie would do our meditation classes. That's where we do yoga. And it's really kind of community spot. And we tell people, just drop in.
And
right?
Isn't it, I don't know what a typical doctor's office feels like in Canada, but usually you're in this sterile environment. It doesn't feel inviting. So there's a lot of patients that as soon as they come in there, they feel more relaxed and more at ease. And that's important.
And this is Tuesday. So when there's a tough case, either a musculoskeletal, back pain, or whatever other patient, every Tuesday we meet for an hour and a half to go through new cases. So if I'm not getting somewhere, maybe I could send them to an acupuncturist, or maybe the acupuncturist would need to see me. So this is Tuesday team meetings. And this is one of our models from Helen Keller, teamwork alone. We can do so little, together we can do so much.
And I also love teamwork makes the dream work. I love that saying.
And we have one goal. Right, we have one goal at Physiologic. This is it, to get you happier and healthier.
Well, that's actually two.
What's one goal and?
Okay, just put two things.
Right.
Okay.
And so with that, I want to just shift over to a video. If you guys don't understand the model, I'd like to introduce. This is like the world premiere video of the Canadian premiere video.
Yes.
Right?
We're global now.
Yes, we're global now. And so it's 2 minutes, and it's a cartoon that we kind of set up to kind of describe it in 2 minutes.
FRESH Med is an integrative medicine practice at Physiologic that focuses on healing the whole person by combining conventional medicine, including medications, clinical nutrition, functional medicine, health coaching, and advanced and comprehensive testing. The FRESH model is an acronym for the 5 pillars of total well-being: food, relaxation, exercise, sleep, and happiness. Food. Food matters. It's the fuel for our bodies to live and thrive. Based on your own individual metabolic and lifestyle needs, the FRESH team will help you discover the foods that truly nourish you, one plate at a time. Relaxation. We live in a fast-paced world trying to keep up with the societal demands and expectations. The stress is killing us. The FRESH team will help you learn how to make meditations part of your daily routine to better manage your response to stress, one breath at a time. Exercise? Sitting is the new smoking, so get up and move. The FRESH team will help you set realistic fitness goals by finding things you enjoy, the key to long-lasting results. one step at a time. Sleep. Sleep is a medical necessity. Nobody can function without it. The FRESH team will help you take a closer look at the reasons why you may have trouble falling and staying asleep, and will help you get the Z's you need, one nap at a time. Happiness. Living with gratitude, meaning, and purpose enriches and improves our quality of life. Using the tools of positive psychology, the FRESH team will support and encourage you to focus on your strengths and pursue activities that truly make you happier, one smile at a time. The FRESH Med team at Physiologic is made up of an internal and integrative medicine specialist, Dr. Robert Graham, and certified holistic health coach, Julie Graham. Together, and along with the rest of the Physiologic team, they've been able to transform people's lives by preserving health and reversing many chronic conditions and diseases through their scientifically backed, safe, effective, and personalized programs. If you are one of many people who have seen doctor after doctor compressed into a 7-minute visit, and been told to take this pill, or if you're tired of having to only rely on medications or been told that there's nothing wrong with you, we can help you. Try a fresh approach and let us show you how you can regain control of your health and well-being.
So that's our video, and this is our prescription. Thank you guys so much.
This is the takeaway right here.
This is the takeaway, right? And so I guess the point of this whole thing is like what Julie mentioned. You're your best doctor, right? And you guys
know your body better than anyone.
And you've taken actually an active role in your own health by coming to Wonderlust, right?
And we're so proud of you. We were saying, like, look at all these people like that are coming here to connect, to do something that's healthy and fun and engaging. It's very inspiring to be amongst all of you.
And you know you're doing well because now insurance companies and other hospital systems are want to understand what we're doing at Physiologic, right? So again, changing communities, changing societies. So this is my prescription for health and well-being. Food, I keep it simple, right? Eat more plants.
Half of your plate. Half of your plate should be vegetables. It's a good way. And in the morning, maybe fruits, and then for lunch and dinner, vegetables.
Relaxation 10 minutes a day?
The relaxation response. Make sure it's simple. The relaxation response. Look into it. It's your greatest tool to combat all the stress around us.
And I always say, if you don't have 10 minutes a day to do meditation, you need 20 minutes twice a day, right? Exercise, move, at least 20 minutes a day. Break a sweat.
Get up and walk.
Just get up and walk.
Take the long way. Take a longer route.
Sleep, like I said in the video, it's a medical necessity. People that sleep 5 to 6 hours a night have a 13% increased risk of death, all-cause mortality. So it's cool. It's a badge of honor. Like, I don't need sleep.
You do.
You do. You know, you're going to die younger. And then happiness. I think one of the most important factors here is that
other people matter. In my Positively Psych talk on Friday, in 3 words, one of the top researchers in the field said I would define positive psychology as other people matter. We can't do it alone. We need each other to feel happy and whole. So keep that in mind.
And to close, this is our motto. When it comes to our health, it all starts with food. But in the end, what we truly want in life is to be happy. And we're really happy to be here with you, and we're really happy to take your questions, comments, concerns, whatever you guys want. And if you guys are interested, oh, I forgot your cartoon.
That's okay.
FRESH Med. You can follow Julie at Positively Psyched and at FRESH Med on social media. This is our website, come us in Brooklyn. We have newsletters that we send out every month. We don't bombard you with information. We actually pick and choose the best to give you.
And we have no children, so we can travel whenever we want. So please invite us to wherever you are if you want us to come, because we are wanderlusters, big time.
Yeah.
Thank you.